Hello, everyone, and welcome to part 2 of chapter 5. And in this, we're going to be looking a lot of accessory structures. I went ahead to say the lines of cleavage or tension lines for this part because basically half of it was 29 slides, and this got me exactly halfway through. Lines of tension or tension lines or lines of cleavage, these are formed by bundles of collagen and elastin that actually run parallel to forces at each location in the skin, so you can actually see them here. These are the grains of the lines of cleavage, so to speak. It's important in wound healing. For example, if damage is parallel to the lines of cleavage, it will heal better. So if you cut it with the lines of cleavage going with it, the wound will close better, it will heal better and scar less. If it's cut against the lines of cleavage, like this, perpendicular to it, it will heal worse. It will scar more and be more difficult to heal. All right. So let's talk hair. Hair covers most of the body, with a few exceptions: the lips, the palms, the hands, soles of the feet, palms of the hands, things like that, external genitalia. The hair primarily does things like protection, sensation, insulation. But hairs are not alive, but they are produced from hair follicles, which are alive. The hair follicle is made of a hair bulb that actually has a mass of epithelial cells that generate and form the hair. Hair papilla, the connective tissue that contains the capillaries and nerve endings for the hair. The hair root anchors the hair onto the skin. And then there is the hair shaft, and that's actually part of the hair that you can see. The shaft is dead cells that are filled with keratin. Now, the color of hair gets it from the pigment melanin and things like that. And when melanin production diminishes, that's when you get gray hair. A hair shaft itself has 3 layers: a cuticle, a cortex, and a medulla. The outer cuticle, the middle cortex, and inner medulla or medulla. Hair color is determined by melanin, but as age, it diminishes, it becomes gray, and this is what happens as you get older, stress, things like that. There is accessory structures of hair. There's a root hair plexus, that's the nerves around the hair for a tactile response, and there's a muscle called the erector pili. They contract and cause the release of sebum. That results in goosebumps. That can be responsive to cold, fear, or even anger. Even sexual arousal can cause goosebumps. All right, so a few things like that. So this is your hair. You could see that we have a hair follicle, and there is all that going on the hair follicle. That we have our cortex, our outer part of our hair. I don't worry about the glassy membrane and things like that. I don't worry about those particular things, but I do worry about the cuticle on the outside, the cuticle, the cortex, and the medulla. All right, I do talk about different kinds of hair. The lanugo, that's the hairs that are shed before birth. They're there to keep a developing fetus warm. It's called embryonic or fetal hair, called lanugo. And then as an adult, you have vellus hair. This is the peach fuzz, the velvet. This is your delicate hair, covers most of your body surfaces. And then terminal hairs, so the large coarse hairs. That'd be on your head, your armpits, your eyebrows, your eyelashes, on your torso, and your pubic hair. There's glands. These glands secrete into ducts and onto the skin. They are exocrine, so they secrete into ducts. There's sebaceous glands. They are oil glands. They are produced by holocrine secretion. The whole of the cell dies. They produce sebum. Sebum is a lipid that coats hairs and inhibits growth, bacteria. There are sweat glands called pseudophorus glands. They produce sweat by American secretion mode. Now, it says depending on location. We actually now know that the apocrine sweat glands secrete by American mode. So I need to update that note a little bit. There's actually a place I updated them later on. Forgot to update this slide. Now, there are types of sebaceous glands. There are typical sebaceous glands. They secrete sebum onto the hair, and there's sebaceous follicles. They secrete sebum onto the surface of the skin. So there's a difference between a typical sebaceous gland, secretes on the hair follicle, secretes onto hair, where the other sebaceous follicles, they secrete onto the skin. Okay, that's what makes oily skin. Now, the sweat glands, apocrine, they're in the armpits, groin, and things like that. They produce a cloudy, odorous secretion. It's actually merocrine, but no one's changed its name yet. So we actually call them their merocrine mode. Now, the merocrine, the typical sweat glands, we call them eccrine sweat glands or American sweat glands. They're over most body, but we'll talk about them as well. Now, hormones control the apocrine sweat glands. That's what causes your your body odors, your BO. Produces your body odors, especially as bacteria break down the secretions. There's eccrine or sweat, American sweat glands. They are found most of the body. They produce sweat, very electrolyte-rich, watery secretion. Sweat is mostly sodium and chloride. It's 99% water, but also contains sodium and chloride as its most electrolytes that it has. Its pH is around 4.0 to 6.8, depending upon the secretions. It functions for thermoregulation and is controlled by your nervous system. Okay. So these are your sweat glands. There's an apicrine sweat gland and there's American sweat gland or eccrine sweat glands. They are both American mode. Okay. So, all right. Now, sweat has a few functions. It cools the body. Sensible perspiration cools the body. You can lose a gallon of sweat in 1 hour with the sweat glands working at their maximum capacity. It functions to excrete water and electrolytes, mostly sodium chloride, as well as some metabolized drugs come out the sweat. Environmental hazards. It can dilute chemicals that encounter the skin. It can also discourage growth of microorganisms by flushing microbes off, making it more difficult for them to attach to adhere. They also produces a peptide-based antibiotic called dermacidin. Okay, dermacidin. Oh, it's dermacidin. I need to check the spelling on my notes. Mammary glands, they produce milk, which is an apicrine secretion, and they produce, that's your mammary glands, and the ceruminous glands, they are sweat glands in the ears that produce a sweat that combines with sebum to form your earwax called cerumen. Nails, we have structures of the nails. There's a nail body, that's the main visible part of the nail. There's a nail bed that's covered by the nail body. There's your nail root where the nail growth occurs. There's the free edge, that's the end of the nail that we actually trim off when we trim our nails. It's the distal part of the nail body, and it's the part we cut off when we trim our nails. There's the eponychium, that's the part called the cuticle. That's part of the nail covered by the stratum corneum called the cuticle. There's the hyponychium, and that's the part under the free edge. That's the skin under the free edge. The lateral nail grooves, these are the depressions of skin caused by the nail pushing into the side of the nail. The lunula is the pale crescent-shaped area caused by blood vessels there. It is not another nail growing under there. Okay. Nails can protect the fingers and toe tips. They can support the digits during physical stress. They're also used diagnostically, like horizontal lines can signify kidney disease. Diabetics can have yellow discolorations in your fingers and things like that. You can have lines of a variety of types on people's fingers when they have damage and stuff like that. But diabetics have yellow nails. Skin can get repaired. I don't go too in detail with this. I talk about it, but it's very hard to test on. Okay, sorry about that. Got an interruption. So we won't go too in detail with it. But I will talk about it. It's very hard to ask good questions for it. They usually find on the test. So we'll talk about injuries to the skin: an incision, a cut, or an abrasion, a scrape. When these happen, a skin is injured. The first step is the inflammation stage. There's injury to the skin. There is bleeding. So a blood clot needs to stop the bleeding. We need to have a blood clot to stop the bleeding. Mast cells will trigger an immune response by releasing heparin and prostaglandins. Then what happens is the migration phase, where scab forms over the injury and stem cells migrate to the area. They migrate. They'll migrate under, beneath the wound, migrating epithelial cells. Blood flow to the area increases, cause mast cells. This brings more macrophages and microphages to the area to fight infections, and this will cause the epithelial cells to migrate beneath the wound. Then there's a proliferation phase. This is where fibroblasts proliferate to make scar tissue. Then there's a scarring phase. Your scab disappears, but a scar will be present. It will be higher than the original epithelium usually. There'll be a raised scar. All right. So that's how the steps in wound healing happen. So if you get a wound, that's what's going to happen. Okay. Once this happens, sometimes we get a combination of blood clot, fibroblasts, and capillaries forming what is called a granulation tissue, or we can get a thickened area of scar tissue that has a shiny surface right here called a keloid, and that's a keloid right there. All right. Now, I do test on classifications of burns based on depth, classification of depth of burns. And that'd be something that will be on the test is burn classification. There's partial thickness burns and full thickness burns. Your partial thickness are the two of those, and there's one full thickness. Now, this is based on how deep the burn goes, the depth of the burn. The first degree will be the less depth. So this first degree burn is only the surface of the epidermis. This is like a type of burn, includes most sunburns with reddened skin reddens. It can be painful. We call this redness of the skin erythema. This results from inflammation of sun-damaged tissue. Second degree, the entire epidermis is gone. Perhaps some of the dermis is damaged. Hair follicles and glands are usually not affected, but blistering happens, pain and swelling. If the blisters rupture, this can cause infections. Typically, healing takes 1 to 2 weeks, and you may have scars from this. Now, the full thickness third degree burn. This is when the epidermis and dermis, even to the subcutaneous layer. Despite the swelling, this is less painful because the nerves are usually destroyed with the burn. These burns cannot be repaired. They're going to because granulation tissue cannot form. The epithelial cells cannot cover the injury site, so skin grafts are needed. Okay, so first, second, third degree burn. I will describe a burn and ask you if it's first, second, or third degree burn. Okay, there will be a degree of burn on the test. So first degree has erythema. Redness is superficial. Second degree takes out all the epidermis and even part of the dermis. Full thickness takes on epidermis, dermis, and even part of hypodermis. Okay, skin grafts are usually needed. Now, the rule of nines, this will also be on there for the adult. The rule of nines will be on the test for the adult. You'll need to learn these. 9, so the head is 9, the upper limbs are 9 each, the trunk is 36, the genitalia is 1, the lower limbs are 18. Now, what we do is the surface area for an adult is divided into areas that are multiples of 9. It makes it easier to estimate the percentage of body surface that's actually affected. So we modify it in children. So what we're going to do for the adult, rule of 9, okay, is I want you to draw a stick man. Okay. Now, there we go. Stick man. Okay, we're going to take a red marker and we're going to go in here and we got 9s. Okay, 9 for the face, 9 for the arms, 36 for the torso. The legs are a little bit bigger than the arms, so let's make the legs a little bit bigger on this guy here. Okay, and they're bigger, and I wanted to make them like twice as big because you can see they are 18 each. Okay, what I normally do is this, and then 1 for the genitalia, and I put it. Okay, yeah, that's on purpose, by the way. Okay, so this will help you learn the rule of nines. Draw this out a few times and you'll get the percentage. Now, what I'm going to do on the test, I'm not going to just ask you what percentage these are, okay? So what we want to do is use this to actually figure out a percent. Now, it is modified for children, but I use an adult on the test. The head of a child is bigger proportionally for the body, so it's 15%. The upper limbs are 9%. The trunk is 32% because it's a little bit smaller. The genitalia is 1%, but the lower limbs are 17%, so they're a little bit smaller as well. So we have to adjust it a little bit for children, okay? Now, so how do we do it? We calculate. We add each percent for an adult or child. This should say or child. For adult or child. We add up the percentages. I apologize for the typos. I never catch them. I'm the only person. I have to write all my notes. I have to write them pretty quickly for a semester to begin. I edit things, and then I'm the only person. I don't have an editor. I teach, like this semester, I'm teaching 18 credit hours. Many times I teach 23 credit hours. I'm very busy, and sorry if I miss typos. So I try to catch them when I make the videos so you guys realize that's what that should be. Now, we have an adult who's burned over their trunk and both lower limbs and genitalia. Okay, so what we would do is we have they're both over their trunk, both lower limbs and genitalia. So basically, we would use this rule of nines, and we have okay, however they're burnt. So let's do one. Let's say we have a patient they're burnt over their head, they're both over their arms, and their torso, their trunk. Okay, now head is 9. Arms are 9 each, so 9 plus 9 equals 18, and the torso is 36. So what we have to do is add all those up, okay? And I'm going to quickly do that. Is 9 plus 18 plus 36, and that's 63% of their body, okay? Of their body. All right. So be able to do a rule of nines calculation, okay? It will be on the test. Okay. 35-year-old female patient presents the ER with secondary burns over the head, torso, and legs after a vehicle accident. What percentage is affected? See if you can do that. Test yourself. See if you can do those kinds of questions. My test will probably be like this, describing a patient that has this kind of stuff. So see if you can do it. So I'll pause it, see if you can do it, and I will give you the answer. All right, with the head, torso, and legs, I got 81%. Okay, so there you go. All right. Sorry, I actually had to pause and calculate. I need a calculator. There will be a calculator embedded on the test, okay? Okay, a few things I want to talk about with aging of the skin is as we end off, and then I have some diseases and conditions and things I don't test on. But aging of the skin, as you get older, the epidermis thins, the number of Langerhans cells will decrease, so the skin gets thinner, so it gets weaker, the Langerhans cells, so you get less ability to fight skin infections. Vitamin D3 production drops, so bones get weaker. Melanocytes decrease, so you're not as dark-skinned. Gland activity reduces, so skin is not as moist, skin dries out. Blood supply, the skin decreases, so skin is not as nutrient dense. It doesn't get as perfused. Collagen decreases, skin is thinner and weaker again. Elastin decreases, skin is less tight, more wrinkled. And then moisture decreases, skin is drier. So skin gets weaker, drier, thinner, less moist, and things like that. So you have to have a lot of problems you have to do with skin as it gets old. Let's talk about cyanosis. That's blue skin. This is a lack of blood flow to the skin. CO2-rich blood will be in the skin, so it'll turn blue. Skin, fingers, toes, and lips, especially. Jaundice, unable to excrete bile, so the protein called the yellow protein bilirubin builds up in your body fluids, and you turn yellow. You get yellowed eyes. Yellows tint to skin and eyes. Erythema is redness. Right here we have a patient who has a tick bite. This is quite a erythema caused by redness of the bullseye for Lyme disease. Okay, fever, hypertension, embarrassment, allergies, infections, inflammation, these can all cause redness. Paleness is called pallor. This could be a normal fair complexion. This could be lack of exposure to sun. It's usually healthier to be pale than tanned. It could be anemia. It could be shock and frostbite. It could be a chronic disease like infections or cancers. You look pale. Addison's disease causes darkness of the skin. So this is pituitary gland secretes too much adrenocorticotropic hormone, ACTH, so skin gets darker. So you're tall, dark, and very slim. So the most famous case of Addison's was actually JFK. Vitiligo is when melanocytes are attacked by the antibodies, causing skin to lose coloration and pigmentation. It's not life-threatening, but you get these patches of light skin, patches of light-colored skin on the body. Vitiligo. Rickets, vitamin D in rickets, the epidermal cells that actually produce cholecalciferol in the presence of UV radiation, that goes on to be converted to calcitriol, which causes you to absorb calcium to make your bones stronger, and then that will cause the bones to be weaker because you don't have enough vitamin D, and this causes like bow legs, for example, in somebody with rickets. Here is a picture of skin to practice on, and there we are. We are done. So guys, I hope this video, you find it helpful, and we'll see you in the next one.